Hello, my name's Caroline Tweedy. I'm one of the clinical nurse specialists at the Queen Eliazbeth Hospital. I'm here today as part of the patient podcast. I've got two colleagues of mine that I work very closely with within the breast department as breast care nurses. We've got Michelle Derbyshire. She's got over 20 years experience of being a breast care nurse. And we've got Rachel, who has got lots of experience working in the surgical department, and in 2018 came along to our wonderful team. She's just recently returned from some maternity leave. She's got a lovely little girl. But we're here today to talk about the one-stop clinics that you may have heard about. So Michelle, you can kick off by, how would a patient end up in one of our one-stop breast clinics?
There's a few different routes. The most common one is a referral in from the GP surgery. So a lady may find that she's noticed a difference and she has a symptom, so she goes along to see her GP and the GP refers her into the system. So it may be that she's found a lump, she's got some nipple discharge, she's just noticed some change in her breast, that she's got a dent, or it just doesn't feel right, or that she's got pain. So there's a variety of different symptoms that the lady would go to see her GP about. He would refer her into the service. Another route would be if a lady develops an abscess. They may go to ambulatory care, which is attached to the casualty department within the hospital. They may have been there out of hours, so been given some antibiotics, but they always get referred into the breast service just to assess the breast and take that forward.
I suppose as well is we see a lot of lactating ladies. And I can imagine when you've gone to the GP or you've gone ambulatory care with a breast symptom, and then they receive a letter to say that it's under the 2-week cancer wait. It's pretty scary, but it's just to try and put people's at mind that, we obviously want to deal with these symptoms as quickly as possible, and that, a lot of the time, that we are assessing, but the vast majority of these symptoms are of benign nature, but do need to be explored and to ensure that there isn't any sort of sinister cause behind them all as well. And I think that's one of the things that we try and achieve at the Queen Eliazbeth Hospital is a very rapid response to these symptoms, because we understand it's a very, very worrying time, but just to try and put your mind at ease when you do that letter through, that there's a lot of different reasons why ladies and gentlemen as well. We do see
men in the one-stop clinic.
Yeah, and some of the reasons for that is that men do develop breast cancer, but they also develop a lot of reasons of why they might have a breast lump. We see men as with who maybe take steroids. There's definitely a more increased chance of seeing lumps like that, or sometimes when men put on weight, they see that the breast area kind of develops as well, which is a change for them. And we would certainly say equally for men as to women is to check their breasts or the nipple areas, and any changes to report that to the GP. We see a lot of different symptoms within the clinic. So a gentleman or a woman receives the letter for their appointment at the Queen Eliazbeth Hospital. What would they expect next to come?
So they would come down to the breast screening unit at the Queen Eliazbeth Hospital and be part of our one-stop clinic, where they're going to have a triple assessment. So what they'll do is they'll come into the clinic and be seen by either a breast care nurse or one of our consultant surgeons, who will examine them and take a history, ask them what the concern is that's brought them into the clinic today. Following that breast examination, they'll then request imaging. Now, depending on what it is that they've come in with and also their age, they'll either get a mammogram or they'll get just an ultrasound scan, or both. And following that, they may then get a biopsy, or they may get a needle aspiration of a breast cyst. It all depends on what we find.
I just want to also add that although not everyone will require investigations, sometimes it may just require an examination and advice, and that's quite a hefty wait sometimes, isn't it?
So you can be in the department for a few hours. Once you've had those images done, you may be discharged straight home after that if there's no concerns, or you may come back to speak to one of the team just to talk you through what they found and what the next steps are.
So just to make patients aware that we don't generally do mammograms under the age of 40. Now, that's not to do with cost or anything like that.
No, not at all. It's to do with the density of the breast, and the mammogram is not the best mode of investigation. The ultrasound scan is more sensitive for the under 40s where the breast is still very youthful, so they would be recommended to have an ultrasound scan.
And I suppose as well, we've got to think of radiation as well. So for ladies who are maybe in the National Health Breast Screening Programme, who've maybe had a mammogram less than a year before they come to this clinic and they've got a new symptom, we don't necessarily do another mammogram at that point.
No, we don't. The National Screening Programme is once every 3 years from the age of 50 up to 70, 73. So if you'd had a mammogram within that last year, you would just have an ultrasound scan unless the radiology department felt that a mammogram would enhance and give them more information. So occasionally it can be done, but that would be on an individual basis.
And I would say that we see a lot of different ranges of symptoms. One of the biggest problem we do have is breast pain, which is a difficult one because sometimes, we understand that some of these breast pains that patients experience can be really, really traumatic. And I think, as patients, we consider pain to be a warning sign. It's something definitely discuss with your GP. Your GP can examine you. Breast pain can be related to hormonal changes. So sometimes your GP might advise you to maybe wait a full cycle before he maybe refers you off to the breast team. Sometimes maybe using analgesics, and maybe consider, have you done anything mechanical, like lift something heavy, or that maybe have been the cause of that pain as well. But certainly, again, we can't stress enough that if it is a new symptom, discuss it with your practice nurse, discuss it with your GP, and let them do the assessment to whether or not it warrants an appointment to come through to the one-stop clinic as well. So just to go back a little bit, when they're examined, the patient's examined and they're sent off for their mammogram and ultrasound scan, it doesn't always necessarily need a biopsy, is that correct?
That's correct. Occasionally you do need a biopsy if it's a solid lump that they're wanting to clarify, and it doesn't necessarily mean that it's a breast cancer even though they're doing the biopsy. Sometimes it can be something completely not benign. It could be a fibroadenoma, which is a benign lump. It could be fat necrosis. You might have had a bump in the breast, and we all knock ourselves and don't realise, and then suddenly have a bruise. And you think, where did that come from? So sometimes you can have a knock on the breast and a little bit of the fatty tissue can lose its blood supply and become a hard, firm lump. And the biopsy just confirms that it is what we call fat necrosis. So there's a variety of different reasons. A cyst could be aspirated. It's just a fluid-filled sac. So it doesn't, even if they do use a needle, for either an aspiration or a biopsy, doesn't necessarily mean that it's going to be a cancer diagnosis at the end of the day.
Yeah, and you will be able to give it an idea, but obviously that confirmation would probably take just over a week before would be to confirm exactly. And, everything is very meticulous within the department. So when these biopsies are taken, they always go to something we call an MDT, which is a multidisciplinary team meeting where our pathologists, our surgeons, radiologists, oncologists come together and we look at the results of those biopsies to ensure that you get the right management. So if it turns out to be something like a fibroadenoma, which is just a benign lump, hopefully you will not need any further intervention. You will be discharged from the team. Sometimes they're not clear-cut, some of these biopsies. Often it might lead to further investigations that we might need to do. But again, the consultant in approximately 7 to 10 days will give you an idea if that needs to be done. But it is a very worrying time, obviously, there to support you. And again, if you have any queries with regards to this clinic, you can contact your GP or your practice nurse, and they can also help with that as well. Would be anything else that
Just to add that we also do a clinic over at Grindon Lane in Sunderland. So some patients locally from the gated area do go to that clinic, but a lot of the patients from that clinic are from the local Sunderland area. It's exactly the same team, exactly the same service, no difference at all. And the other
just
thing
a different venue.
Exactly. And the other thing to mention is clothing. And when you come to the clinic, obviously we're going to ask you to take your top things off, your bra and your jumper or your blouse. So it's best to wear trousers or a skirt on the day that you come to clinic. You will be given a gown. Some patients will even bring their own dressing gown in because they feel more comfortable in their own clothes. But modesty is maintained throughout the whole experience. And it is a ladies' waiting area. You wouldn't be expected to go out into the main waiting area where there's other patients in the waiting area.
And obviously this recording is being recorded during the time of the pandemic, so obviously we've had to make alterations with asking visitors to come along with patients. So, things are changing from a week-to-week basis. Prior to COVID, we would recommend that a patient would bring along a partner or somebody along there just for some support, really. But again, if you've got, other commitments such as childcare or being back at work, do try and, understand that you could be in that department for up to 3 to 4 hours.
Yes, quite easily. Yeah.
And I think it's already a very pressurised time, a very anxious time. What you don't want on top of that is thinking, oh my God, I've got to be back for the kids, or, my boss is expecting us,
Plan for 4 hours, and if you're out before then, that's great.
And I suppose sometimes these biopsies as well, you might feel a little bit shaky afterwards. It might be best that somebody maybe drives you home, or you might need a stiff cup of coffee when you come out just to kind of, get you home safely. There's just those aspects. Please don't put yourself under any more pressure and expect to be sort of seen.
Back to work on the afternoon.
Yeah. It's certainly a full morning or a full afternoon out, and read material again is very advisable just to wind those hours away. But I think that's about it. Like I say, the vast majority of these lesions and things that are found, turn out to be nothing. But what we would say is encourage ladies to be vigilant, to understand their breasts, understand any changes, and if in doubt, always consult with a professional who's qualified, not Dr. Google. But again, resources like breast cancer care are excellent, just to kind of cross-reference.
Give you an idea of what you're looking out for.
Yeah. Oh, well, thank you very much. It's been really informative. Thank you.
You're welcome.
Thanks.